Greetings. My name is Donna.
And I am John, here to discuss sickle cell disease (SCD), both the trait and the disease.
In this short video, we will briefly go over the history, genetics, prognosis/symptoms, and treatment of SCD. Most importantly, we will discuss what you, as the viewer, can do to help.
Think fast. Here are some quick facts. 1. Sickle cell disease is a group of red blood cell disorders inherited from your parents. 2. There is an estimated 70,000 to 80,000 Americans who have SCD. 3. Sickle cell disease affects people of many nationalities, including Italians, Latin Americans, Greeks, Arabs, Asiatic Indians, but most predominantly found in African Americans.
That is absolutely right, John. And unlike normal red blood cells, which can live for 120 days, sickle-shaped cells live only 10 to 20 days. When they sickle, they often get stuck in blood vessels, causing chronic episodes of pain, called crises.
Alright then. I think that covers our quick facts for the basics. Donna, take us away.
You got it, John. Let's brush up on our history and genetic origins, shall we? First off, we would like to thank Dr. James B. Herrick and his intern Mr. Ernest Irons for figuring out what the collections of clinical findings meant in 1910 in Chicago. Dr. Herrick was a cardiologist as well as a medical doctor who happened to have a patient with escaping conditions.
And you are now speaking of our patient Zero, am I correct?
That you are, John. And for those who do not know what or who patient Zero is, it is the person who was the first to have the disease.
The number 0 is our hero. Walter Clement Noel, age 20, was a student who was sickly in December of 1904. He remained sickly, according to Dr. Herrick's article, until April 1907, when presumably he died somewhere in Chicago.
Genetically speaking, there are 3 common forms of sickle cell disease. 1. Hemoglobin SS or sickle cell anemia. 2. Hemoglobin SC, and 3. Hemoglobin S beta thalassemia.
People who have hemoglobin SS form of SCD inherited 2 sickle cell genes S, one from each parent. This is often called sickle cell anemia and is usually the most severe form of the disease. People who have hemoglobin SC inherited the sickle cell gene S from one parent and another abnormal hemoglobin C from the second parent. Finally, hemoglobin S, also called sickle beta thalassemia, which is also a form of Cooley's anemia, inherits one sickle cell gene S and one gene for beta thalassemia, each from 2 parents.
Confusing enough? Don't fret. This is a lot to digest in a little over 10 minutes. But to expound a little further on this topic, just like John said, there are 3 common forms of sickle cell disease. Those are abbreviated HBSS, HBSC, and HBS. Hemoglobin SS is the more severe form out of all of them, while generally the other 2 have a more milder form of sickle cell disease. Take note that hemoglobin sickle thalassemia S has 2 forms within itself. The most severe form is marked 0, while the milder form is marked by a plus sign.
Most importantly, hemoglobin is a protein that allows red blood cells to carry oxygen to all parts of the body. And just like it takes 2 to tango, sickle cell disease has an autosomal recessive pattern. This means that a child will not inherit the disease unless both parents pass down a defective copy of the gene. Because of this double factor, we now have a sickle cell disease trait and sickle cell disease. Donna?
We are doing great. I think it's time to identify some of the symptoms and learn the prognosis of SCD. Some symptoms are not limited, but include delayed growth, strokes, extreme pain/body aches, and jaundice. Sickle cell causes damage due to the lack of oxygen supply to various organ/bodily tissues and organs. Many people with SCD experience different things. Some may have more crisis outbreaks, calling for frequent hospitalizations, while others live with it comfortably. A patient's lifespan is on average reduced by about 30 years.
That we are. This audience is the best. I'm sure they will become great experts of sickle cell disease by the end of this video. And maybe they will even take a peek at the associated documentary our studio's creators have made as well.
Bingo, Jack.
Great job. My name is John.
Okay, moving right along. With early prenatal care and careful monitoring throughout pregnancy, women with sickle cell disease can still have a healthy pregnancy. More precautionary measures need to be taken. There is always a risk that the disease may become more severe and pain episodes may occur more frequently, or even high blood pressure. There's also a higher risk of preterm labor or having an underweight baby.
Furthermore, children with sickle cell disease are very susceptible to infections. Signs of impaired lung function may occur in the early years of their life. Older patients have to deal with associated medical problems from long-term adverse effects of the disease. The most serious dangers are acute chest syndrome, long-term damage to major organs, strokes, vision loss, etc.
So now that is covered, let's move on to treatments, okay? Common treatments includes having blood transfusions. Providing the patient with healthy red blood cells, doctors advise people with the disease to get plenty of rest, stay hydrated, and avoid strenuous activities. Younger children will often take penicillin to prevent infections, while older patients may take folic acid to promote the production of red blood cells. In most severe cases / most invasive treatment, a bone marrow or stem cell transplant would take place.
Regardless of the fact that you may have sickle cell disease, trait, or not. Here are a few things you can consider. 1. Stay informed or get tested for the condition. The less you know can hurt you. 2. Give support to those where support is needed. You can accomplish this by creating a local or family support group, or by becoming a big brother / sister figure for those in need. Let's face it, most people with sickle cell just need an understanding ear, to know someone cares and that they are not in it alone and will support whatever may be going on. 3. And for those who do not have the disease or trait, donate some blood. A little blood goes a long way. Blood transfusion is a very common type of treatment, but nowadays there isn't enough blood nor diversity of blood type to go around. Lastly, those who are living with the disease or trait. Get regular checkups, prevent infections, learn and adopt healthy habits, look for clinical studies, and get support.
John, I think that concludes this video introduction to sickle cell disease. We hope that you all learned and enjoyed. Don and Depos. Don't forget to watch the associated documentary that our creators made. I am Donna.
And I am John. Until next time.